That's too much, or that's so much time. Yeah, like
everything's
who
hard.
else are you gonna bet on? You might as well bet on yourself. That's the best way to go.
Yeah.
She like 5'2", yeah, she got her hair done too. You don't think I give it to her?
So hi, welcome back to my channel. I am Tasia, and this is
Amanda,
my wifey, my bestie.
Yes.
Everything. Today, I thought it would be a good idea to talk about our backgrounds because I started medical assisting differently than she did. So I figured it'd be best to get someone with a different experience, and it just so happens that she's one of my best friends, so it works out. How I started medical assisting was through my mom. She went through a medical assisting program that took a year. So the first 6 months is like what a receptionist would do, like front office stuff, and then the last 6 months is medical assisting. The last 3 weeks of school, I was on externship. I got hired an hour away from where I live. I did that because they hired me within a week. Within my graduation, I got hired, and that was what was most important to me. I wanted to work for this particular organization, so I was like, I'm gonna do whatever I need to do. I was up at 5 o'clock in the morning, not home till 7. Worked in kidney and nephrology department, which is kind of sad. Kidney disease is very serious and terminally ill patients, so I only really had 1 or 2 patients a day, and I was working from 8 to 5, so there'd be plenty of days where you're just sitting there not doing anything at all. Pick up sometimes, but majority of the time my boss would let me go home early if I just asked him to, because he knew how far I lived, so he didn't mind. Completely different than my externship experience, because my externship was procedures, like some sit down, like rooming patient stuff, but I think that's going to nephrology or just reminded me that I want to be a busier medical assistant. I don't want to just sit around and not do anything. I got an interview out here 20 minutes away from my house, and their hours are great, 7:30 to 4, procedures all day long besides some office days. Being in a procedural setting instead of a clinical setting makes your day go by faster. You feel better about yourself when you go home. It was way closer to my house, so I'm just extremely happy that happened. People ask me all the time, like, oh, how'd you get in anesthesia? I just applied. I had no idea what anesthesia was when I did it, so finally when we got into the department, we're doing epidurals and injections, all that kind of stuff. I was like, this is perfect for me. I couldn't imagine doing it any other way. Mm-hmm. So, and the lady that trained me, Anya, she goes to the nursing school that I'm trying to get into. She graduated from there, so she gave me a bunch of information about it and made me even more passionate about becoming a nurse. So getting into medical assisting, you meet people with all different kinds of stories on how they get to where they are. Everyone's story is different, and that's how I met Amanda again. So yeah, I'll let her say her story now.
So mine was totally different. I actually was in the process of finishing school just for my associates, and I ended up taking a break off of going to school, and I went to medical assisting school, but my program was only 2 months.
Lucky.
And it was probably far less than a lot of people, but it was up front. So I think that was probably the difference. There was no financial aid, so it was you either had it or you didn't. But
if you don't mind me asking, how expensive was it?
It was I think it was about $3,000.
$3,000.
Yeah, and that was included everything.
$1,600.
Oh, I thought you were gonna say 16,000. I was like, oh my gosh.
But she raised the price now because she has that, plug with the organization. So
yeah, well, and because now more people are seeing the type of money that medical assistants can make, and just how this is it can be a career.
Mm-hmm. You can stop
they can do
here.
That.
Yeah, mm-hmm. If you want to be that, you could stop there
and still make decent amount of money. But the program that I went to no longer is 2 months, because they do phlebotomy with it as well. So it is more expensive, and I think it's a month longer. For about a good, probably 3 weeks, I had my externship. It was in adult medicine, and I did it part-time while I was still working at Kohl's. After, I went on Craigslist.
What?
And found my job for the
I didn't
private
know that.
practice. Yeah.
Wow.
My dad was really irritated because my dad paid for my
Everything.
program, so he was like, you need to find a job. So he told me to go on Craigslist, and I found a job.
That's crazy. I had no idea.
Yeah, so if you need a job, go on Craigslist.
Craigslist.
I found a job at a private practice, and I worked there for about 9 months.
How was the private? I've never worked in a private practice.
So private practice is more exciting.
Mm.
Because you want to be that busy MA. That's what you're doing. They taught me how to do front office. I became a certified drug screener. I did help with the physical therapist. They had acupuncture, and they had like DOT physicals, which are for like the truckers, like, I had to do basically everything: EKGs, blood draws, things that you get certified in.
Girl.
Yeah, you get certified in medical assisting school, but you don't usually do them at a regular hospital or clinic setting. That was really exciting. It just didn't pay well, and it was like 2 hours from my house, so it wasn't worth it after a while. But I was doing like 10 to 12 hour days, so yeah.
No.
I was doing nurse things.
I'm like, yeah, you're basically like, the furthest thing that I've done out of my scope, I felt, was in San Francisco when I was doing injections all day.
Oh.
And out here in this service area, you're not allowed to give injections for some reason. I think that's stupid.
Even though they teach you how to do it
In school.
it's so,
because I know some people in the comments were like, oh, do you have to be certified in phlebotomy? And that, I never got trained in phlebotomy in school.
private practice, it's more of a fine line because of the fact that it's their practice. Technically, like, I am taught how to do it. I can legally do it, but like if Kaiser, I couldn't apply for a job because I'm not certified solely in phlebotomy. So private practice, it was still fun. I love the people, I love the doctors I worked with, but it was just not worth it.
That's 2 hours.
Yeah, I made maybe like $2 more than what I made at Kohl's.
Oh.
Yeah. But I needed experience.
Yeah, true.
So most programs that you go to, if it's not through like a big corporation, you have to have experience.
Yeah.
So I needed to do what I had to do, and then I ended up applying after 6 months, and then I got interviewed with the anesthesia department. And that's where I saw Tasia again, who I've known for like ever.
I trained her.
Yes.
I trained her. I was so happy. I was like, yay. Because, no offense, everyone in the department has babies and they're married and they're older. It's very rare that you get someone your age in your department. Because medical assisting, I feel like, just recently got popular within the last 2 years. Like, not a lot of people are knowing about it. Majority of the people who are in it were like late 20s, I would say, late 20s and up.
Well, and they've been doing it for
years.
a
long time. Yeah. And I became a medical assistant at 18, so me coming in, they're like, oh, you're a baby, and I'm just like, okay, still,
all the time.
Yeah, still can't do anything. Like, so when she came, it was the best time. We had so much fun at work. Oh my gosh, I'm not even funny. That doctor that I mentioned in my video a couple videos ago, he loves her. Dr. Mar, he loves her to pieces.
Miss him.
You trained with me for like,
I think it was like a month.
I think.
Yeah.
For a month. She was on call.
Yes, apply to the on-calls.
Yes.
Don't be too proud.
Yes, I actually started on call. I was on call, and then 3 people didn't want to work with this particular doctor, so they kept leaving the department, and then I got transferred into being 24 hours there. It just happened because right place, right time.
Yeah, that's the only way. Is actually I've heard it within the higher corporations is like on the on-call positions and floats are actually the only way for you to get in to their hospitals. Any positions that are usually benefited are for the employees that are already within the company. So your best way to get in is to just on call and float, but apply to everything because you never know.
It was fun.
Yeah.
And you left me.
Yes, I had a little move. So now I actually have a job. Before I was traveling like a good maybe 45 minutes to get to work. Now I only travel at most 20 minutes. Now I work in surgical specialties, and I absolutely love it. Now I do like nine different departments that I cover. I'm still on call because I go to school, so it's worth it because I literally work 40 hours, and if I don't want to, I don't have to. It's a really good idea for people who want to continue their schooling and their education.
Once I got benefited, she knows because she worked with the same manager under me. She never gave me time off to go to school. So when I became my 24-hour, I had to build my school schedule around the time that we worked, which pushed me back at least 2 semesters.
Oh, yeah.
So I just finished school last year. I could probably been done a year ago. But that's besides the point. But in my opinion, yes, being on call is probably the best option if you're going to school, especially if you're in that younger age group where you're still benefited under your parents. I think ours is 26.
26, yeah.
26, yeah. So the need to be benefited is really for people who have like kids or you're not already covered under your parents' insurance, something like that.
So what I'm currently doing now is I'm back in school. I wanted to do ultrasound for the longest. Actually, the Dr. Marr, who we were talking about, was strongly pushing me towards nursing. But I didn't want to because I felt like everybody wanted to. So I was like, no, I'm going to do this ultrasound. It's good. Like, I'm going to just do that.
And they make good money, too.
They do. They do make good money, and it's short.
I think it
short
goes
amount.
like reception, medical assistants. I don't know if CNA and MAs make the same amount.
Yeah, no, CNAs make less.
Oh, okay.
Yeah,
CNA,
CNAs.
MA. Sterile processing.
And then there's like
surgical tech.
Yep.
And then
I think that's where you get to like ultrasound
and radiology.
Yeah.
They're like.
It's honestly, it's good money. I did apply for school twice because with ultrasound they only do school once. They only allow you to apply once a year, and I did not get in. It was actually a crazy story, and my friend actually got in instead. But that's totally okay because I don't believe that it was actually meant for me to be there. Because life would have been totally different right now. After that, I applied the next year to the program where I went to medical assisting, but they were a newer program, so they did not offer financial aid yet. Financial aid can only apply to a school if they've had at least 2 successful graduating classes, and they had only been open for 2 years, so they only had 1 successful graduating class. And ultrasound school is expensive, so I didn't have just like $15,000 laying around.
Who does?
So I don't got it like that. So basically, I got into that program. This was before I knew that they didn't have financial aid, and I just was like, I can't do it. Like, I wouldn't be able to make the payments that are needed because it's an everyday thing. It's the classes are every day, and so I actually didn't do that. So for a while I was a little discouraged. I absolutely love caring for people. I love just being there for people as much as I can in such a vulnerable state. So I was like, you know what? I'm gonna do it. I'm gonna just do it. And I actually found a school that's about 30 minutes from my house. What really got me was their mission statement. Their mission is to build you as a person, to make sure that you are whole, that you can be that change, and bring it into medicine, so that you can better care for people. And that just sold me. That is what I literally am about. I want to not just give you the best medical treatment that I can, but like personally treat you better than like I possibly could. I want to love you like I've known you for my whole life.
And I think that's what I learned being in anesthesia, is because the person leaves feeling better.
Yes.
And like that, people,
Help
when
you
they're in
a lot.
pain and then you relieve their pain, they'll hug you, they'll love on you.
They'll cry. Oh my god.
Thank you so much. Like, and you just made you could make their whole year, the rest of their life, whatever the case may be. Like, the fact that you have such an impact on someone within such a short amount of time, like, those are the best days.
Yes.
Like, those are what really makes me have a good day. And I feel like I learned that with anesthesia, because all the other departments are kind of like quick fixes,
yes.
or, you know, we can't really help you, or something like that. Especially nephrology, there's really nothing. Like, it's kind of just touch and go with maintenance. But, like, being in anesthesia, like, they'll come in pain and they leave with no pain. Like, it's like Christmas, like, basically, because you get to help everyone, and there's a solution to their problems, and they're happy when they leave. They're not always in the best mood when they get there,
but you know, nobody is when they're in pain.
Yeah.
And I think even, like, lovely trainer here, she taught me a trick of rubbing our patient, because most of our patients are laying on their stomach when I worked in anesthesia, and just rubbing their calf to distract them, but also to let them know that they're not alone, that they're, you know, that it's not just the doctor doing what they're doing, but there's somebody here.
And you have to supplement for their bedside manner sometimes.
Yes. So be the bigger person.
You can't.
Sometimes you don't want to. No. You don't want to touch their calf.
And that's the thing, because, like, you have to find a fine line between not picking sides. Like, so if the patient doesn't like the doctor and they're bad talking, you can't be like, yeah, you know, he's not a really good doctor, or, like, you can't say negative things on the doctor's side and allow him to
get away with
treat him or her like they're not a regular person. So just make sure that you're keeping that, like, fine line. And I think that's what makes a good day too, is when you can just make everybody happy.
Well, and on top of that, it's always it's always a choice. You know, you're either gonna let everybody affect your day, or you're gonna just go in there choosing to be happy, to be joyful, and to let that, you know, radiate on other people. And if they don't want to take it, they don't want to take it. That's their choice. But it's not going to change who you are. It's not going to change how you're going to treat them, you know. So it would make me feel the best when somebody did treat me very rudely, and I still continued to comfort them, because
there's so many opportunities in healthcare to make yourself, I hate to make it sound selfish, but it's like you make yourself feel better when you do acts of service like that for other people.
The medical field is definitely a great way to do that. So even learning that, like, when she taught me that, I took that in every area that I'm in now. You know, I actually got a couple of compliments of just how well I can comfort a patient, and it wouldn't have been if
shout out to
if I wasn't in anesthesia. That was everything I needed.
So when do you apply for your nursing school?
Oh yes, about a year, and then I'll be on my way to Broke Life for a minute.
I already applied, and I find out on March 15th if I get in.
Which she will.
Please pray for me.
She will.
Yeah, without medical assisting, I wouldn't have got to nursing at all. Like, of course, it's, like, really cute in high school to be like, oh yeah, I want to be a nurse, and then you, like, figure out how hard it is and how long it takes, and you're like, okay.
You're like, do I?
Yeah, and then you get into medical, and then I got into medical assistant, and I was like, I want to do more. Like, I'm not satisfied.
Yeah.
Like, I want to be more involved. I want to know more things. I want to be more knowledgeable.
It's really good if you don't know what you want to do, like, if you feel like you want to do the medical field, I feel like medical assisting is, you know, a great way to go, because you kind of get close enough to see if that's where you want to put your foot in.
Yes.
But it's also kind of further enough to where you don't have to be all the way in.
There, yeah.
Exactly. It's really good to know if you can or can't, because would you hate going through school and paying $200K and then find out you can't do it?
None of that. I wouldn't have had any of that experience going into a university, like, just with the idea, I want to be a nurse. Like, okay, but do you really?
Do you know what like, I mean, and it, like, nursing is, like,
tough.
Like, they do everything. Like, do not think that you can get away from anything, you know? They do all the down and dirty stuff. So I've had to ask myself multiple times, do you really feel like you could do this?
And I've been with her while she wanted to be an ultrasound tech, and I've tried to convince her to be a nurse. She's like, no, like, you can be, and I'm going to be.
Yeah, we'll do that and share stories.
Yeah, because I was like, oh, you should just be a nurse. Like, but, yeah. I'm glad we're on the same journey yet again.
I know.
So it's going to be so fun. Hopefully we can work in the same hospital one day.
I know.
Again.
I know.
This time
That
don't
would be
leave
good.
me.
I won't leave you. Are you capable of going further? Because if you are, then do it.
Yeah.
Like,
the best investment that you could do is yourself.
Yeah.
So when people shy away from, oh, well, that costs too much, or
Oh,
oh,
this
that's
is
so
too
much time.
hard.
Yeah, like,
everything's
who
hard.
else are you going to bet on? You might as well bet on yourself. That's the best way to go.
Yeah.
I
Well,
feel
and it's like everything's hard. That was one of the things that I didn't want to do nursing. I thought it was too much responsibility. I feel like it'd be really hard, but I've started to learn that, you know, everything in life worth having there's gonna be a challenge.
And you feel way
so.
better about yourself conquering
Yes.
challenges that were put before you.
Mm-hmm.
I feel
Yeah.
way better about it.
I'm like, do it.
I don't regret any way of how I started. You know, I wanted to go to university straight out of high school. That's what all of my friends are doing. I felt completely left out.
Yep.
When I did not go. I was like, everyone's partying and I'm here.
You're like, what am I supposed to do?
Yeah. So, and I was completely did not want to go to community college. I think you remember me not wanting
No,
to
yeah,
go to
you
community
were-
college. I was
no.
not keen on that at all. I was like, I have to go back to school. Like,
And it's not a
there's
university?
there's no nursing program
I know.
without like, yeah, seriously. And
You
so,
can't
like,
just teach me on the job.
right.
Don't ever do medical
I
field
feel
for
like,
money.
Oh no.
Ever.
And you can tell the difference between a medical assistant who thoroughly enjoys their job and
Mm-hmm.
then just does not care, because once you're hired, you could do anything you want in a way, but that's not what you were hired to do. You know,
Exactly.
you're there to help other people. You're not there for yourself. And so for anyone who does things like that, is not a good area for you to be in. You should be
It's
in a
not
cubicle
fair.
because
Yeah.
you have to, it's a selfless job. You have to completely take away anything that you're going through on the outside and just serve the person that you're responsible for that day. Yes, we do get paid very well. I wouldn't have it any other way.
know.
But there's more benefit to that than just, okay, I get paid very, very well. You know,
Yeah.
like the biggest reward, like we said, is putting a smile on someone's face that you don't even know. A stranger, like, oh,
Literally.
makes my heart warm.
That's really beneficial because it becomes personal. Like, it becomes something where it's like I can't wait to see you healed. I can't wait to see you get like through this. It's not just okay, cool, like, you know, letting the nurses know your patient's ready. Like, no, it's not just that. It's literally like how are you doing today? Like, you know, you really want to genuinely know how they're feeling, what they're going through. How can you better serve them?
And
you
patients remember things like that. Like,
Yeah.
they pay attention to you. Like, they're like, oh, I was with you last time. And that means a big deal to them because they love familiarity.
Yeah.
Like, you remember me or whatever.
And it was like
kissing.
months, and
Yeah,
they say stuff like that.
yeah.
Like, you were there, and I'm like,
I lie. I'd be like, yeah.
I'll have to go through the note again. Like,
yeah. What?
was I?
Yeah. So they remember, they pay attention, and you know, they feel your energy just as much as you feel their energy, and it's just important to always be on the brighter side of that at all
Yes.
times.
Like, it's not about you. That's like the biggest thing that you just have to remember is it's never gonna be about you. The second you take things personally,
Nobody is turning and being like, "Are you okay?"
definitely not. I mean, your friend, like the people that you develop relationships with, they will.
Your coworkers, yeah.
But there's also a time and place, right? But of course, life happens. But still, like the main thing is like if you're healthy, which you are because you're at work,
True.
you need to be asking, is the person okay? You know, so just think about that before you go into the medical fields.
Yeah, it's a
But-
huge step.
Yeah,
A good step,
it is.
but a huge step.
It changed me. I thought I hated people. I wanted to be a vet.
Yeah, and I'm hecka shy.
Yeah.
I'm so shy. I'm comfortable now.
Yeah.
Like going up to people and making conversation. I can do stuff like that now because it's my job, you know?
Yeah.
I love it. So happy.
No, literally. It brings you out of your shell. That's why it changes you. I really love people. I mean, sometimes I'm like, dang, I don't know why you're acting like this, but you know, people do have hard days, and that's why you get to be the person who brightens their day.
Yeah. Yeah.
I'd rather have that on my belt. So.
Same.
Mhm.
Yes. That's the thing too. It's about who you know. If you don't know someone, if for a particular company, try to, hey, does your mom, does your brother, does your cousin, does someone that you know that I know work for that organization, because if you put that in your application or mention that during the interview process, they're like, okay, so and so knows this person, so they're reputable.
That's what helped me.
Yeah, because I think after you left, she asked me. So after her interview she had with my ex manager, she asked her like, oh, like how's Amanda? You guys used to cheer together. I was like, yeah, she's great. Like I hyped her up. I was like, yes, she's awesome. She's amazing. Like it's really about your connections with other people. You're on your externship. Make relationships.
Yes.
Make them.
Yes.
I don't care if you don't like the person. Make the relationship, because it's important in the hiring process.
Matters.
It's a huge, huge, huge deal. Like
Yeah.
they care about who you know and who's in your back pocket and who's supporting you.
Well, and
That's
it's
a
all
big
about
deal.
team. It's like it's a team thing. So if she said I don't work well with others, then I don't get the job because
That wouldn't have happened.
you know, like so if you don't work well with others, you better learn
Yeah.
to work well with others,
I
or at
mean,
least
we were pretty independent, but you know, when we have a lot of questions,
yeah,
for new stuff, so it's definitely important. Teamwork is a huge deal.
you know, still be flexible. 'Cause-
Yeah, you're gonna make mistakes. You're gonna
and don't beat yourself.
Yeah, don't beat yourself up about it. Don't cry about it. Like it's
Why?
fine. Don't cry. I taught you better than me.
Cry in the bathroom, okay?
Yeah, don't let anyone see you.
Don't let anybody see
I have
you.
this coworker who cried in front of her doctor. Who cried in front of her Dr. Beer. Who cried in front of her doctor, and he called her into his office after the procedure was done. Even the patient told her, like, your doctor is being mean to you. So he calls her into the office, just her and him one-on-one, and he's like, I didn't think I was being that rude. Why are you crying?
Oh my goodness. All right.
So, don't cry,
Just
but don't take disrespect in a polite way. Like,
Yeah.
you were hired for a reason. You got through school for a reason. You completed everything that you were supposed to. You're here for a reason. So, you know, everyone makes mistakes. Doctors make mistakes. Okay? I've been there
Yeah.
for a lot of them. Okay?
Yeah, I'm like, I've definitely been
nobody
there.
is higher than anyone. It's just about being efficient at your job and how well can you perform a particular task. Sometimes you're not going to be very good at it, and that's okay, but you have to learn from them. The thing that they don't like is when you repeat mistakes. You can make a mistake, but don't be a repetitive offender of it.
You
like,
know.
don't get into the habit of doing things that you're not supposed to be doing or that you should have done.
And just remember.
Yeah.
Remember everything. Examples.
Opportunities.
Yes.
Take advantage. Boom. Change the world. If you guys have any questions, please leave comments below. Amanda is always going to be here. If you have a specific question for her, I'll just text her and she'll get back to me and I'll answer your question. Once again, I'm Tasia.
And I'm Amanda.
And thank you for watching.